Hello, everyone, and welcome to today's webinar on COVID-19. And we're looking at SARS-CoV-2 testing beyond the clinical space. It's a great honour for me to be able to present this on behalf of LGC Axio Proficiency Testing. Today, we are very lucky to be joined by Valerie Bardin, who is the Global Product Manager for LGC Axio Proficiency Testing. And we are going to be spending some time looking at some exciting new areas of testing development in the fight against COVID-19 today. My name is James Sizer. I'm the Global Senior Brand Manager for Axio Proficiency Testing, and I'll be taking us through the early part of this presentation before handing over to Valerie to go through some really great scientific content on a couple of really interesting areas. So I hope you get a great deal out of it. At the end of the session, we will have an opportunity for a questions and answers section. So please do let us know if you have any questions. You can type that in the GoToWebinar questions or the chat function, and we'll endeavour to get to as many as we can towards the end of this session. Ultimately, the reason for us presenting to you today is for us to look at SARS-CoV-2 testing beyond the clinical space. Now, the truth is that the rollout of vaccinations in many countries around the world is really gaining momentum at this stage. So there is maybe a feeling and a hope amongst scientific communities as well as global populations that we're looking at the beginning of the end of this pandemic. And although that might sound a little bit optimistic with many countries under quite severe lockdown conditions, the daily news on the rollout of vaccines is, at the very least, it's promising that we're entering into a new phase of this pandemic. So we acknowledge as a group that vaccinations are going to be dealing quite a substantial blow to the virus, but we aren't necessarily seeing the very end of this, and it certainly doesn't signify the demise of the virus. And we'll be hearing a little bit more about some of the kind of the future state as we move through this webinar. What is absolutely obvious is that we're going to have to start monitoring the levels of SARS-CoV-2 in many different ways, and this goes beyond just the clinical laboratory or the confines of individual cases. And so really this is an opportunity for us to look at a number of different areas of testing and support our partners and laboratories around the world with something a little bit different. We're very privileged at Axio Proficiency Testing to be able to work with laboratories who are at the cutting edge or even just participating in sectors working in very different areas of SARS-CoV-2 testing, whether it's in the food and beverages industry, in the environmental sector. We do work very closely with the clinical sector. But ultimately what we are seeing is that the idea behind SARS-CoV-2 testing is spreading beyond some of the more accepted and understood clinical investigations into new and exciting areas. It's been clear for a while that understanding the full extent of this pandemic and the impact it's having is an ongoing challenge for public health officials. So governments, legislators, regulators, public health organizations, and even private businesses and individuals are really struggling to find the right metrics or the right insights to understand this virus and its prevalence more clearly as we move through its evolution. I think it's obvious to everyone that every single day there is something new being found about this virus and how it's going to affect us moving forward. So it's starting to look like diagnostic testing capacity may be somewhat insufficient. So that's not to do down the role of the clinical laboratories or any of the results that are coming out of things like hospital monitoring. But it is true to say that hospitalisations may lag infections by weeks. So we know for a fact that the virus can is sometimes only really known about weeks into its presence in patients. But similarly, they won't necessarily give us an accurate report of those who have mild or asymptomatic showings of this disease. So what that means is ultimately that number of people will not necessarily attend hospital and therefore won't fall into the statistics that are being released on a regular basis. So Increasingly, scientists are looking beyond clinical testing to monitor, measure, and even predict pathogen transmission. So what we're going to look at is some really, really thrilling spaces of testing that maybe will show us a light for tackling this pandemic in the future, not just in the now and present. So at this stage, I'd like to hand over to Valerie Bardin, who's going to talk us through two of these really exciting areas and maybe give us some insight into the future of SARS-CoV-2 testing. So Valerie, thank you very much, and it's over to you.
Thank you, James, for this introduction to the reason why clinical testing is not and cannot be the only tool in the fight against SARS-CoV-2. I'm sure that most of you have already heard about the monitoring of SARS-CoV-2 in wastewater because of the question of the potential risk to population, of course, but also, and I would say mostly, because it can be a sensitive surveillance system in an early warning tool. So let's explore if and how sewage can be a weapon in tracking the spread of SARS-CoV-2. The past experience with several viral diseases has shown that monitoring untreated wastewater for traces of a pathogen, a virus, a bacteria, can be an effective way to survey the entire communities because it provides a signal of whether the pathogen is present in the population and whether the transmission in the population is increasing or decreasing. Wastewater monitoring is commonly used to track the presence of enteric viruses. And it's interesting to notice that some previous studies have used urban wastewater to monitor some diseases such as polio or the consumption of drugs in the population, drugs such as ecstasy. Some research work that has been performed in 2015, so well before the COVID-19 pandemic, and focusing on Paris, this work has concluded that there was a significant underestimation of the diversity of enteric viruses circulating in the human population. When testing for wastewater, you would find what you are looking for, but I would say you only find what you are looking for, and there is much more in the wastewater than just what scientists and labs are testing. So therefore, the analysis of wastewater treatment plant effluents could be used to explore the viral diversity, of course, in environmental waters, but also in the human population. And this can be used to better comprehend the viral epidemiology and could help to forecast some seasonal outbreaks. It is not currently possible to convert directly the concentration of viral RNA found in wastewater to the prevalence of SARS-CoV-2 in the population. That would be nice and easy, but this is not possible. And several factors would influence this conversion, or should I say this absence of conversion. First, the huge variability in the excretion of RNA between individuals and over the time. Some studies have shown that approximately half, and I would say half only, of the patients have fecal samples that are positive for SARS-CoV-2. The second factor that would influence the conversion is the variability in the sewer systems. Their size can be very different, their configuration, of course, whether they would include industrial wastewater or rainwater. And if they include rainwater, therefore the weather and typically the quantity of rain would affect this conversion. So it's not possible. But even if the direct conversion is not an option, some study results have strengthened the evidence that wastewater monitoring can be a powerful tool for tracking the spread of SARS-CoV-2. And many countries have already set up a network of laboratories to monitor the presence of the virus in wastewater over their territories. As an epidemiological indicator, diagnostic testing is not sufficient because, again, it does not report on people with mild or even asymptomatic disease. So it's well admitted that SARS-CoV-2 transmits predominantly among humans and via the respiratory route, droplets, etc. At the beginning of the pandemic, the question of a possible fecal-oral transmission was raised because SARS-CoV-2 genetic material was found in some fecal samples, and also because diarrhea was one of the symptoms of COVID-19 at some individuals. But no study has confirmed this possible fecal-oral transmission of the virus. And also some studies have shown that SARS-CoV-2 is very unlikely to survive in the very acidic environment of the human stomach. And it appears that the diarrhea symptom in COVID-19 positive patients is not likely to be due to contaminated food, but is more likely to be due to the classical transmission through the respiratory system. So it's clear and well admitted that SARS-CoV-2 is not a proper enteric virus as, for instance, norovirus would be. That said, several studies have shown that the virus can be found in stool samples from some patients infected with SARS-CoV-2, and it is also admitted that fecal samples can remain positive longer than respiratory samples. So today, results from different studies have strengthened the evidence that wastewater monitoring can be used to track the spread of SARS-CoV-2. One of the very early study that was made about SARS-CoV-2 in wastewater was published in May 2020 and was monitoring the wastewater in the area of Paris. So this study showed a very clear correlation between the quantity of SARS-CoV-2 genomes in the Parisian wastewater and the number of new COVID-19 cases observed at a regional level in the population. It was also clear that when the COVID-19 cases dropped in the population after lockdown, the researchers observed a subsequent marked decrease in SARS-CoV-2 genomes in the wastewater. It was also important and interesting to note that the SARS-CoV-2 genomes could be detected in the wastewater before the exponential growth of the pandemic. As James has mentioned in the introduction, it's very likely that the destiny of the SARS-CoV-2 is to become endemic, and the world will have to learn how to live with COVID-19. So, of course, vaccines and good hygiene practices will be very important, but wastewater surveillance is also likely to play an important role because it can be a cost-effective way to survey the transmission dynamics of the virus in entire communities. And if it is successful to reveal infection dynamics earlier than the diagnostic testing itself, it can provide public health systems with, let's say, near real-time information on disease prevalence. Today, there is no, or maybe we should say not yet, any regulation for SARS-CoV-2 in wastewater. However, an increasing number of labs are assessing the presence of the virus or even quantifying the number of copies of the virus in wastewater using molecular analytical methods. So the protocol is that wastewater is sampled from wastewater treatment plants, and the virus is concentrated, this can typically be done by ultracentrifugation or ultrafiltration. This is done prior to the extraction of viral RNA and then the RT-PCR test itself. Some specific extraction protocols and specific extraction kits have been developed by some manufacturers because of course, the bacterial and the organic load of wastewater sample is expected to be much higher than clinical samples, so they have to be treated in a different way for the sample preparation and extraction. As the number of labs who are monitoring the presence and the levels of SARS-CoV-2 in wastewater is increasing, it's important that they have the possibility to ensure that their methods and their results are reliable and accurate. This is the reason why LGC Axio proficiency testing now offers a new PT sample for the detection and eventually the quantification of SARS-CoV-2 in wastewater by RT-PCR methods. So the sample is part of our water microbiology proficiency testing scheme, which name is QWAS. The participants will be sent some non-infectious samples provided in a synthetic wastewater matrix. And those samples are compatible with molecular assays that target CDC and WHO consensus genes. So the non-infectious sample will contain the entirety of the SARS-CoV-2 genome. So all genes are present because different methods may target different genes. So this sample, PTWT430, will be supplied as 2 different samples. And to guarantee the stability of the material provided, each sample has to be reconstituted by mixing the reconstituted wastewater with a spiking solution that, of course, will or will not contain SARS-CoV-2 and can contain SARS-CoV-2 at different levels. The laboratory will report the presence of SARS-CoV-2. They can also report the number of virus copies per milliliter that they were able to find in the sample. And the first SARS-CoV-2 in wastewater samples will be dispatched on March 15th. If wastewater testing is likely to be a recognized tool in the fight against the virus, let's now explore how and why surface testing has also a role to play in the fight against the transmission of the virus. It is now clear that the main route of the transmission of SARS-CoV-2 is from person to person via droplets. But it also appears that the risk of contamination via contaminated surfaces cannot completely ruled out. At the early stage of the pandemic, several cases of contamination, for instance, in the food production sector, maybe you have heard about contamination in slaughterhouses, but also in places like hotels and restaurants have been reported. And environmental testing of the contact surfaces is one of the control measures that support cleaning and disinfection decisions and can help companies protecting their employees and their customers. Since the beginning of the pandemic, the ability of SARS-CoV-2 virus material to persist on surfaces and the risk of transmission through those surfaces has been, if not a concern, a question. One study that was using a DNA surrogate for contaminated body fluid showed that within 10 hours, the viral material had spread to 18 other surfaces in various areas. This study may not perfectly reflect the risks posed by a RNA virus, and there is still clearly there is still a need of a better representative surrogate material to perform more transmission and disinfection studies. But it is it still well shows that viral material can spread very quickly and very effectively. Several studies have also evaluated how long the virus can last on various surfaces, such as glass, plastic, stainless steel, paper, etc. And studies have shown that the virus can last several days on some surfaces, such as glass or ceramic. So now that the understanding and the knowledge of SARS-CoV-2 has developed, it is recognized, of course, that hand washing and disinfection does substantially reduce the risk of transmission. SARS-CoV-2 is an envelope virus and it is susceptible to a number of disinfectants and biocides. However, formaldehyde spread continues to be an area of investigation, and special attention is paid to certain surfaces, such as stainless steel or packaging. A few studies have been published, mostly from China, and showing that the presence of the virus of viral material, which is a bit different, but the viral material can be present on some imported food packaging. Also interesting to mention that at the end of January 2021, 5 commercial methods have been validated by AOAC. There is no ISO equivalent of the validation. No ISO validation has been performed yet, but the microval experts have evaluated the approaches taken by AOAC PTM, a validation program for the detection methods of SARS-CoV-2 on those environmental surfaces, and they say that they fully support this AOAC initiative. Today, the validated surfaces are limited to stainless steel, but AOAC announced that the validation will expand to a broader range of environmental surfaces in the near future. Surface testing for viruses is a relatively new area for many laboratories, and it is important that those laboratories can ensure their methods and results are reliable. And LGC Actio Proficiency Testing offers a PT sample for surface testing in the format of a SARS-CoV-2 viral transport media from a swab. So this sample is part of our environmental hygiene monitoring PT scheme, which name is hygiene, and participants receive 2 1.5 milliliter liquid samples, different samples, and they are assessed on their capacity to correctly report the presence or the absence of SARS-CoV-2 in the sample. So this sample is not brand new, and 2 rounds of SARS-CoV-2 on surfaces have already been carried out. And you can see here the result from the second round. So 2 samples were dispatched, 1 positive, 1 negative. On the second round, 24 participants tested the samples, and the satisfactory performance was 79.2% for the positive sample, 83.3% for the negative sample. When it comes to methods, so of course the labs do report the methods they are using to test the sample, but it is quite difficult to make any statistical conclusion about the methods that are used by the labs, because a number of labs report the use of laboratory developed methods, and very few labs report the use of one specific commercial method from end to end. So maybe we will be able to make more statistical analysis of the methods in the future. So the next round of SARS-CoV-2 on surfaces is planned to be dispatched in July 2021. Thank you for your attention, and I will now pass over to James for the conclusion.
Thank you, Valerie. I think everyone will agree that's some really interesting areas that are emerging in the testing of SARS-CoV-2 and therefore the fight against the COVID-19 pandemic. I think what I get to do here is I get to introduce a little bit more about the role that proficiency testing in particular can play in that fight and what is available to us. So really, I think I need to start this off by explaining that we definitely don't consider that that clinical testing is no longer one of the most critical areas of testing for this. It's more that we are now looking at some exciting other areas. I think it's been over a year, scarily, since this virus emerged, and since then it's been absolutely incredible how the global scientific community has come together, the various different ways in which the virus has been combated. And I think one of the key things that the scientific community has done is guide legislators and leaders and governments towards the most suitable responses. Everybody has had to learn as they go, and that includes the scientific community. But what is clear is that laboratories around the world are uniquely equipped to test, measure, evolve, and develop the processes that are going to enable the testing of SARS-CoV-2 that's going to make a real difference as we move forward. If we haven't already been, the whole year has been a historical moment in a sense, but we are maybe at a critical tipping point here where the vaccination programs that are emerging offer the possibility to calm or quell the pandemic's fury. We may be at an opportunity here to slow down its impact and to start protecting the populations against it. But as Valerie mentioned, we're approaching a stage where we are going to be living with this virus, and it means that we can't afford to take our foot off the gas. We can't slow down our efforts to both understand, gain insight, and, as mentioned previously, start to maybe even predict the patterns of its spread. So in terms of proficiency testing, what we've had the opportunity to see as a proficiency testing provider with partners all over the world is that every laboratory has been touched by this. Nothing is untouched. And, we are indeed an organization of laboratories. So we have seen firsthand the impact this virus has had on the laboratory environment, whether it's methods, processes, colleague safety, the testing that we're providing for others, all of those things, they are affected, and no doubt that your laboratory is no different. So I think the new areas of testing, such as wastewater, but also the hygiene surface monitoring, and there are others emerging, these are increasing in prevalence and focus, and that's because every laboratory has been touched by it. Every laboratory has a role to play in the fight against the pandemic. And therefore, there are new methods, new opportunities, and new processes appearing in every single sector. They all represent useful tools to the scientific community. And it's been fascinating to be a part of the development of some of those processes and opportunities. One thing it has done is most definitely highlighted the importance of those laboratory processes and methods, but also the importance of them being accurate and reliable. As with anything, the challenge behind measurement of something new and something emerging is the fact that a great deal of the baseline that you will have established in your laboratories may be challenged by that new element. And I think we, as a proficiency testing provider, have worked really hard to keep in step with those emerging testing trends and new methods and processes. So what that means is we want to be there to always support laboratories with the basic support that you need to make sure that your measurements are accurate and reliable. So we always say that proficiency testing is a critical tool in ensuring laboratory performance is consistent and that measurements are accurate and reliable. So consistency is obviously key for a great number of laboratories, not just in terms of the actual measurements that are being outputted, but also improving that consistency and quality to key stakeholders, whoever they may be. So in ISO 17025, which a number of you may be familiar with, proficiency testing is laid out as a key external quality assessment tool. And it can support pretty much any laboratory in any sector doing any kind of testing work. But I think really key at the moment is this opportunity to support laboratories that are responding to the current pandemic. So some of these are just the traditional ways in which proficiency testing can support and aid a laboratory, but some of them have really gained importance over the course of the past year. So yes, we have an opportunity as a proficiency testing provider to give laboratories the tools, the background, and of course the data sets to fulfill their accreditation requirements. But the role of proficiency testing for any laboratory goes beyond that. So it's an opportunity to demonstrate competency to customers and regulatory bodies. Now, those customers and regulatory bodies now may be governments that are looking for laboratories and science to really support them in their guidance on how to tackle the pandemic. They may be businesses or organizations that provide goods or services to the general public, and therefore we have a new threat that we need to protect against. But demonstrating that competency as a laboratory is obviously really important to inspiring confidence in the populations at this critical moment. I think maybe this past year has shown a number of the difficulties in dealing with a pandemic on an international scale. But what's been amazing is seeing how the scientific community has come together across borders. And it's that global community that we serve that offers such great value to all of our partners. So the opportunity to compare your laboratory results with laboratories around the world means that really you're getting an opportunity to benchmark your work along with peers, no matter the work they're doing and no matter their location. So again, in this kind of post-pandemic time, I think that global view is really important as we look at these emerging areas of testing. Proficiency testing offers an opportunity to manage risk through the early warning of potential problems. So if you're finding there are any major issues in your processes or analysis or in the output of your measurements, then proficiency testing can spot those potential risks and potentially give you a pathway to corrective action that can prevent more costly mistakes further down the line. Along with that, there's an opportunity to verify your methods and instrumentation. And again, this is where our work comes in terms of how much effort we're putting in to stay on top of the emerging trends of SARS-CoV-2 testing, because as soon as those trends appear, as soon as those needs appear, we want to be there to support people with the opportunity to verify the new emerging methods and instrument responses. So we are putting a great deal of resource, emphasis and insight into working on that, but we rely on our partners for their guidance, support and sharing their needs with us. And then finally, there is still an opportunity to educate and train staff. So I always try to emphasize that proficiency testing isn't about necessarily testing the staff, it's about testing the measurements that you're outputting. But there is an opportunity to work with proficiency testing samples to establish the norms for your analysts. And testing a proficiency testing sample can really help establish the critical skills for staff, but also, especially in these new emerging areas of testing, it gives them an opportunity to get familiar with the things that they're going to be carrying out on a much more routine basis as they contribute to the fight against the pandemic. A little while ago, we sat down as a company and really talked this through. And some of the closing remarks in our response to the pandemic and how we were going to support both our colleagues, but also our partners and customers around the world, came from Brian. So Brian Brookman is our Chief Scientific Officer at Proficiency Testing at LGC, and he's one of the leading experts in this area. So I hope he doesn't mind, but I'm going to be reading out his quote word for word, because I think it really establishes what we're so proud to be a part of. So governments, health bodies, hospitals, virology labs, and indeed most of the world's population find themselves locked in a war with the novel virus SARS-CoV-2. LGC is directly involved in COVID-19 related work, from supporting diagnostic kit manufacturers, diagnostic testing and clinical research, to providing quality assurance tools to ensure reliability of the measurements being made. It is our hope that by using new proficiency testing programs for SARS-CoV-2, external quality assurance measures will be in place to support all such testing worldwide. Together, we can ensure accurate and reliable testing as the world unites to combat the spread of the virus. And it's the hope that we're providing those quality assurance measures that are going to enable and provide the platform for the great work that laboratories are doing in this fight that really drives us at the moment. And to be honest, it's something that's driven us for 40 years. So Axio proficiency testing is the fair name for the proficiency testing offer coming from LGC. So again, we have been working on this for 40 years, and we've been leading the direction of proficiency testing in that time, whether it's playing a key role in the development of international standards or just establishing the expectation of quality in proficiency testing samples around the world. The most important thing for us, though, is that we design our schemes to meet future needs. So we don't look at the past, we look at the future. We call ourselves a partner. You've heard me say the word partner repeatedly today. But the reason I say that is because it's the partner needs provided to us that really establish where we go next and how we can make sure that we are serving the scientific community in the way that we are both designed to, we are asked to, and that will ensure everybody's success as we move forward, especially in these critical times. We believe that great results are born out of confidence, and that by working with us, you can have the assurance that your decision making is informed, reliable, and effective. And ultimately, that's what we're here to do as a proficiency testing provider. It's to work with you to provide you with the data that enables you to be confident in your work and your outputs. Pretty much a final note on us, really. I mentioned earlier the importance of the global community in these current times, and I just wanted to flag that currently we provide over 2,300 proficiency tests every single year to over 13,000 laboratories, and those laboratories are situated in over 160 countries. I genuinely come to work every day really proud to be serving such a global community, and it really enables us to have the insight into the needs of laboratories that go well beyond our locale. And we have offices all over the world, and more than that, we have local PT specialists in a great deal of countries. That means that we have a really expansive capability when it comes to languages, in communication tools, etc. So the truth is, come and talk to us if you would like to. We will do our very best to speak your language, to understand your needs, and work with you very closely to get to where you want to go. Whether it's our existing offering or something that's coming up in the future, we work really closely with our partners to make sure that everyone is served in the best manner possible. So ultimately, this is a call to come talk to us if you would like to know more about our SARS-CoV-2 offering, but also any other needs you might have. You can learn a bit more about that at lgcstandards.com/Axio, which is your source for all information regarding our offering. You could get in touch with us by email at axio@lgcgroup.com. But similarly, all of our details are on our website, and that includes our local offices information. So you can get in touch with your most relevant office or PT specialist. Those PT specialists, all of our community is also online on both LinkedIn and on Twitter. So just have a search for Axio Proficiency Testing or LGC Axio, and you will find us, and we share a great deal of information and resources on there. So we would love to have you join in our discussions online. So thank you for listening to me. Next up is really an opportunity to look at some of your questions. So we have both Valerie and also Tracy Noblet on the line as panelists. So Tracy is our head of microbiology at Axio Proficiency Testing, so is uniquely placed to answer some great questions on these samples. So again, type any questions you might have in the chat function or the questions function, and we'll get to them as quickly as we can in the next 10 minutes or so. So we have one question here that says, sorry, I'm just going to try and follow it. Andrea, I'm not entirely sure I fully understand your question. So let me have a quick look at that and I'll move on to it in just one moment. In the meantime, if anyone else has any questions, please let me know. Okay, so we have one here about the wastewater sample. So Valerie, this might be one for you. So there's a question of why don't we send out real wastewater for the sample?
Well, I would say there are actually two reasons why we do not send a real wastewater sample. First of all, shipping real wastewater containing, real positive wastewater sample is a logistic challenge because that means sending some infectious sample, and this is the reason why for our SARS-CoV-2 samples we have decided to work with some reference material that contain the entire genome of the virus. All genes are present, but they are non-infectious. So it makes our life much easier when it comes to shipping those samples globally. And the second reason is for stability of the samples. Well, SARS-CoV-2 is normally quite stable at low temperature for a couple of days, but that would require to be able to ship certainly some frozen water, and that would certainly be a challenge, not in all countries, but we know that in some countries we would not be able to ship frozen sample all way long. So there would be there would be in some labs some stability issues, and those issues are fixed by shipping some wastewater sample that have to be reconstituted.
Thanks, Valerie. I think that's pretty clear. So thank you very much for that. Another question that we've had is, are these PT exercises qualitative or quantitative? Again, probably one for you, Valerie.
I can answer, but maybe Tracy will, or Tracy, you can answer this one, maybe.
Yeah, I can step in. So the hygiene one that's already gone out was purely qualitative, but the wastewater one, we are offering it as qualitative and quantitative. We understand that the methods are very much in the development. So the quantitative one is almost a sort of test to see how many people are wanting to do quantitative tests and how they want to report those results. But the option is there to do either or both.
Excellent. Thank you very much. Going back to the wastewater sample, I think a couple of people are keen to ask, does it include the COVID variants? So does the wastewater PT sample include the COVID variants?
Well, the answer is no for the next dispatch date. Well, we know that every new PT sample can be a challenge for some labs. So we will not send any variant in the first dispatch of the wastewater sample. That is likely to be different in the future rounds, because we will certainly step by step also include some variants in some of the wastewater samples.
Excellent, thanks, Valerie. Appreciate that. So, I think the question from Andrea that I was trying to get to earlier is around the validation of the use of a lysis buffer as transporting media. And I think the question is there any validation of the use of this lysis buffer as a transporting media instead of anything else for sample analysis? Does that make sense to either?
Well, I'm not sure what you mean by validation of this. I mean, we do not validate proficiency test samples. If it's a question around the whether or not the sample is in our scope of accreditation, the answer is well, not yet, because we will need to show first results to our accreditation body to be able to get accreditation for this sample. I'm not sure I have answered the question, but I'm happy to take that separately, probably with Tracy, to provide a better answer if this is not the right answer.
Yes, no problem. So, Andrea, just a quick note that we can get in touch with you directly to make sure that we're giving you the right information. So we'll drop you a email following this webinar just to make sure that we can give you the right answers. But thank you very much for your question. Okay, does anybody else have any other questions? I think we've covered the majority here. Just double check the chat. So at the moment, that looks like that's pretty much everything. So thank you very much, everybody, for joining us today. We hope you have found great value in this webinar. So these are two really exciting areas of emerging testing in the SARS-CoV-2 fight, but there are going to be more. So we will do our best to keep you updated on our work and what we are seeing emerging out of our partners' laboratories as well. So really, it's just for me to say, firstly, join us online, whether it's LinkedIn, on Twitter, or pay a visit to our website to learn more about us and the work that we're doing. But similarly, I'd just like to say at this stage, thank you very much for joining us, and thank you very much to both Valerie and Tracy for their contributions and answers to questions. So thank you very much, everybody. Have a wonderful day and take care. Thank you. Bye-bye.